I am a rural family doctor and former emergency room doctor um, in southern British Columbia. I live in Lytton, BC, in a very small community where I am the only resident doctor. I got into a lot of trouble during the pandemic for publicly revealing what the COVID shots did to my patients. And so I suppose I became known for as what the government called a spreader of misinformation, because I was literally telling people what I was seeing in the pandemic, which was zero patients coming to the ER and a lot of people very badly injured by the COVID shots. So I guess that's who I am.
All right. Well, I'm glad that you're with us. I was listening to when your speech at We Unify last year, and it was very, very interesting to hear what you had to say, especially that you actually stood up against it. I believe, were you standing up against the College of Physicians and Surgeons? Is that what it is called?
Yes, yes. So
Okay.
they charged me with professional misconduct
Wow.
for talking about vaccine injuries.
And you were actually had the charges dropped. Is that correct?
Yes, so they literally shortly before the trial, they dropped all the charges when they saw the legal evidence that I had to defend myself. They just dropped everything. But meanwhile, had dragged me through uh, I think it was 3 years of
Wow.
legal cost and stress and expense, charging me with this professional misconduct for literally doing my job as a doctor. For being ethical. You were supposed to just look the other way when people were being hurt, and I wasn't willing to do that. So that's what got me into trouble with the college.
Well, I'm glad it's the level of importance of people like yourself standing up against what they were doing to people and physicians saying, no, there's something wrong here. I don't think we fully understand yet just how important that was because it makes people think and it saves lives, truly.
Well, there were a lot of people who were deeply mistrustful of the shots and didn't believe Bonnie Henry and Adrian Dix, who was our Minister of Health at that time, um, that this was fully researched and was safe and effective. They just didn't believe it, and they had good reason to mistrust it. And so I've had thousands of people tell me that the fact that I, as a family doctor who was a first-hand witness of what it was doing, was willing to stand up, made them feel validated, made them realize that they weren't a wingnut conspiracy theorist, that they were right, that they had every reason to mistrust the health authorities and to mistrust public health, who were betraying them. And so we now have an absolute crisis of mistrust because the medical profession failed to stand up. It literally betrayed people. Thousands of doctors who were just too afraid to speak against the narrative, even when they could see what was happening, because they saw what was happening to me. I was sort of the chosen sacrifice, I suppose, by the college. I sent a letter to Dr. Bonnie Henry very early after the first round of shots. When I saw what was happening, I sent her a letter to tell her what I saw in my patients. And the response of the college was to send a warning letter to every doctor in the province that if you speak misinformation about COVID or the COVID vaccines, you will be put under investigation and, if necessary, disciplined, which is exactly what they did to me. So the fact that, and they gave me a gag order. In fact, Interior Health gave me a gag order very early on when I started pointing out safety signals, and they told me I wasn't allowed to say anything negative about the shots. And if I had complied with my gag order, I would have been betraying my patients, and I
Mhm.
would have been betraying the Hippocratic Oath to do no harm. And so, unfortunately, most doctors were more concerned for their own safety and well-being than they were for their patients. And so they kept silent. Um, and I suppose I put the well-being of Canadians and my patients above my own well-being and risked all. And I have no regrets.
Wow. It takes a lot of bravery to decide that the greater good matters more than anything else. And you've most certainly done that. And I think it was an example for a lot of people and other doctors and nurses and medical professionals to understand
Yes.
that there might be something else going on. There was something else going on, and to think for themselves a bit. And maybe it was the chosen sacrifice, but it's important that somebody does it, even if the cost is great.
Well, you know, fear is contagious, and that's what happened during the pandemic.
Yeah.
They used fear to control people. And for some people it was fear of the virus, and for some
Mhm.
people it was fear of the vaccine, and for some people it was fear of the authorities. But they used fear to control people. And so if we don't want to be controlled by evil people, we must refuse to be fearful. And and I suppose courage isn't the absence of fear. Courage is doing the right thing even when you are afraid. In other words, it's not allowing the fear to control you. And and just as fear is contagious, so is courage. So I think it's so important um, to stand up because it inspires other people
Mhm.
who see that I am still well and I am still happy. And yes, I lost a lot. I lost my medical practice. I lost my wife. I lost my children. I lost so much through this, but I did the right thing.
Mhm.
And so if those were sacrifices that I needed to make, so be it. But the greater good is what motivates me.
Absolutely. And I think that's what's so important about like we're having this conversation ahead of a conference where people come together and get to see that there are other people like them. I know a theme that I found in people I met through the last few years, they felt very alone if they were standing up, or they felt very alone if they were questioning things. Things like the vaccine and the pandemic and all that went down in that time, and all that continues to happen. And when you go to something like a conference where you meet other people in person in real life, and you get to say, "Oh my goodness, there are other people who think like I do. There are other people I can learn from. There are people who I can watch be courageous and feel more courageous myself." And it is a great opportunity to come together and connect.
Yes, you know, the reason why propaganda works is because most people just want to follow the herd. And the trouble is, you can follow the herd right off a cliff if you just, you know, some people feel
Hmm.
safe because they want to be in the middle of the herd. They don't want to be an outlier. They know as an outlier, they can be easily singled out and attacked. So they stay in the middle of the herd. But when the whole herd is going off a cliff, that's not a good place to be. You need to be that outlier that says, hang on, I'm not going in that direction. And so reclaiming Canada and the whole purpose of this conference is so important because it draws those people who are able to think critically together and those people who are willing to stand up and say, no, I'm not going to follow this herd of lemmings off the cliff. It makes
Yeah.
no sense. I am not a sheep. I'm a thinking person. And you know, one of my heroes from the past is a British statesman called Edmund Burke, who lived in the 17th century. And he's famous for saying, all that is needed for evil to triumph is for good people to do nothing. And so we dare not do nothing. And and,
Hmm.
and so this reclaiming conference is so important because the purpose of it is to firstly educate people, to go there to learn about what is happening and what other people are doing to make a difference, but also to be encouraged and to be inspired. And when you get like-minded, positive people together, there's an amazing synergy. There's an amazing energy from being together. And a lot of hugs go on there, and a lot of wonderful friendships are forged
Yeah.
and connections. And so that is the joy of actually being there rather than just looking at it online, is that that energy and that love that comes from having people who really care about this country together.
Yeah, and didn't have the opportunity to go last year, but I went in 2024, and that was absolutely the experience. Is you're watching these speakers, these incredibly talented people, but you're also meeting people who just came to the conference. And I find when you meet people who are just there to learn, you actually learn how to articulate yourself better and you learn how to phrase things. Because I think a lot of the time people don't feel ready to stand up or they don't feel like they can because they feel like they don't know how to say it. And
Yeah.
when you go to something like a conference like this, you actually watch people articulate it very, very well. And then you can take that, and next time you have the opportunity to be that light to somebody, you
Yes.
feel that you can articulate it.
Yes,
Hmm.
exactly. No, exactly. It's a building experience. I think it gives people, it doesn't just inspire, but yeah, it encourages and it builds you up and shows you that gives people ideas of what they can do to make a difference. Because we all need to be doing something, um,
That's where they
in
say
whatever way.
That's where they say we all have a sphere of influence, whether it's the person you see at the grocery store or your friends or your family or someone like you who has influenced many, many, many more people than you probably even know. We all have a sphere of influence and it does make a difference, whether it's small or large. I I would be curious. Um, so with everything that happened, because you come from a healthcare background, I would be very curious. So many things are politicized. And I find when topics get politicized, like healthcare, it becomes left versus right. It becomes mainstream narrative versus people who have, say, very different opinions as you experienced, and things we're told we can and cannot say. I would be curious on your take as to how politicizing healthcare has taken away from patient focus and healthcare really being effective to help the people that need it.
Yes, healthcare has been enormously politicized, and particularly in BC through Bill 36, which is now
Yeah.
called the HPOA, which I'm sure will be a hot topic once again at this conference. So, this very strongly politicized healthcare, where doctors are no longer regulated by doctors, but they are regulated by the government, where the government will tell them what they can or cannot say, which means that doctors are no longer free to be doctors. There are certain things you're not allowed to say. And so
Yeah.
once you have science and medicine being politicized, um, they are literally shackled. They cannot you you can't practice medicine where you're told you know the government doesn't have a medical license. The government is
Yeah.
not a doctor. The College of Physicians and Surgeons is not a doctor. They
Mhm.
don't know my patients and what my patients' needs are. So for them to tell me what I may or may not say to my patients is absurd, because they are not the doctor. And there's never a one size fits all medical solution ever.
Mhm.
Every person is unique, and there is no medical treatment, no vaccine, no anything that is suitable for everybody, because
Mhm.
everyone is different. And so that is why that patient doctor relationship is so important and is sacrosanct. And when the government starts interfering in it and telling the doctor what they may or may not do, I mean, of course, I'm not saying there shouldn't be ethical standards. Of course,
Mhm.
there needs to be. But this government micromanagement of everything, including medical care, is not about ethics. It is about absurd levels of um, technocratic bureaucracy. It is just about control. It's not about care. It's about control. And so the politicization of medicine is a disaster, and the healthcare system in Canada and in BC is literally collapsing. The wait time to see a cardiologist now in Kamloops is 2.5 years. And so there is an absolute crisis of medical care. And
Mhm.
a lot of it is because of the politicization of medicine, where doctors are just going into early retirement or leaving the
Yeah,
province, or people just aren't going into medicine anymore because of this government stranglehold that has politicized it.
absolutely. And I've seen that very close hand. My mom has been an ER nurse since, I mean, she started before I was born, and she's left the ER department to work in a different department simply because they were so short-staffed all the time. She was so stressed every time she went to work and felt like she could barely stop or breathe. And some of the stories she's told me over the years of what she was dealing with when they were so incredibly short-staffed, it's like, she'd be in charge of the department at Langley, which is a much smaller hospital than it ought to be for the number of people that now live in the city. And she said, like, at one point, they're putting stretcher of someone who might have a heart attack just in view of the charge nurse station because there's no nurse to take care of it and there's no beds. And it gets really, really bad.
Mhm.
And she told me years ago that if the general public knew how bad it was inside the hospitals, there would be public outrage. But that's why I'm so interested in the politicization, because when you have the left and the right fighting it out, then people are so distracted by their political beliefs that they're not even focusing on what's right in front of their face, which is the incredible decline in healthcare in our province and in our nation. That is, people are dying on wait lists for surgeries in a first world country, which is quite frankly absurd.
Yes. No, it's tragic. It is absolutely tragic. Canada is on its way to no longer being a first world country. It is
Yeah.
absolutely in decay. And this government monopoly on healthcare is not working. The trouble is socialism creates massive debt because it is so expensive. This nanny state where the government controls almost everything is an economic disaster because the government is so inefficient. And so we have a crisis because the government is sort of drunk on power and drunk on spending money and and seems to be working very hard to fulfill the United Nations Agenda 2030 with, loss
Yeah.
of private property um, and reducing the population, whether it's through MAID or through um, the disastrous COVID vaccine rollout, which has reduced
Mhm.
fertility and reduced life expectancy. These all seem to be um, they really seem to be on board with bringing about Agenda 2030, mostly with removal of private property and reducing the population. And then, of course, they really obviously want the the digital dollar, the digital currency, and so
Yeah.
their reckless spending and handouts to which will destroy the Canadian dollar. Eventually, it'll just collapse. It'll be worthless, and then they can bring in a digital dollar where they can control everything that you buy or sell. And if you donate money to an organization like this
Mhm.
that they don't like because it's critical of them, they can just shut down your bank account. Or if they
Yeah.
decide you've eaten too much meat this month, they can suddenly impose 100% tax on meat that you buy or gasoline or whatever they think you've used too much of. That's what digital currency will do. They will be able
Mhm.
to control everything that you buy or sell, or just freeze your entire bank account if you donate to a freedom convoy or something like that.
Yeah, and in so many ways you can watch. It's like we're watching them condition the majority of Canadians to be okay with it.
Yes.
And I mean, they did it with masks and telling everyone you have to do this, and they did it with the vaccines, and they're doing leading towards things like digital currency. And I mean, Canada in so many ways is becoming what you could call a welfare state,
Yes.
where people are happier to sit at home and receive a welfare check than to go out and live their lives and make a difference in the world. And we've essentially been conditioning people to avoid hard work, avoid critical thinking. I mean, you watch what they're doing with our education system with young children. I'm 23, like I've watched a lot of people I went to high school with, and you can see how people you can see so clearly how people start to accept these ideologies because it's less effort, it's less accountability. And if you abdicate personal responsibility and personal accountability and you want someone else to take care of you, then it's, oh, great, the government's going to do this and this and this for me, and I don't have to do anything. It's the low effort, it's the low effort, no responsibility approach.
That's exactly correct. They will sell digital currency. Of course, one of the things that they'll say, well, it'll stop money laundering.
Hmm.
They'll sell it as that, so a safety issue, but they'll
Yeah,
also sell it as convenience, just amazingly convenient. And
yeah,
but people need to realize that what the other side of that coin is. That other side of coin is complete loss of freedom,
yeah,
where you're no longer free to say or do or use your money will no longer be
yeah,
your money. It'll be their money, and they'll decide whether or not what you can use it on. And
yeah.
and so it's critically important that people realize that it's actually all about freedom.
Absolutely. And it's the same you were mentioning before with MAID. I was actually just last night looking up some of the statistics on that, and it's the numbers are getting higher and higher and higher for MAID. And it's very sad because the criteria, and I'm sure you know as a doctor, the criteria is not, it sounds when you first read it like very, very hard to qualify. But then you look into it a little bit further and you realize it's not nearly as hard to qualify as you think. And then you combine the statistics of MAID with the statistics on abortion in Canada, and you get about a million people since 2016, and that's over 2% of the Canadian population, which is a very substantial number.
It's terrifying. I mean, and this seems to be part of the because the number of people opting for MAID increases by about 30% per year. So we're now up to 100,000 people, and this was legalized in 2016. Started off with very small
Yes.
numbers, but we've now reached the point that 5% of all deaths in Canada are people being killed by a doctor, which is absolutely horrendous. And so, with the collapsing healthcare system, obviously, this is more and more attractive for people
Hmm.
who are desperate because they're not being cared for. And
Yeah.
so, and the fact that they call MAID and
Hmm.
abortion healthcare is absurd. Killing people is not healthcare.
No.
And so this issue of MAID is horrendous, but it is absolutely in keeping with the aims of the government and the United Nations to reduce the population by getting rid of the most vulnerable people in society,
Yeah.
the unborn and the sick and elderly. Just
Yeah.
delete them. The people who cannot defend themselves, it is absolutely sickening that they are
Yeah.
being killed by doctors.
Yeah.
It is not right in any way.
No, we're meant to be a first world country and leaders. And I mean, I think we have, at one point, we were that. And at this point, we're using our tax money to kill our population.
Yes.
And even the fact that you hear these stories, both in Canada and the United States, of mothers who are told, oh, your child might be born with insert this condition, Down syndrome, autism, many others. And then they say, oh, well, you should just do an abortion and I guess get pregnant again. And if that's eugenics, that is systematically trying to kill a certain part of the population and saying that they don't have value.
Yes.
And what's so funny to me is again with the politicization of these topics, the people fighting pro-abortion are the same people saying don't discriminate against someone for a mental or physical disability or because they are old. But it's okay to use our tax dollars to kill them.
Yeah. No, it's absolutely appalling. And if people knew what the MAID process involves, and perhaps we will talk
Mhm.
about that at the conference, because I would
Yeah.
like to speak about that. how they actually kill these people, which is portrayed as death with dignity. It is the the process is absolutely horrifying. And I think if most people who opt for MAID knew about how they are killed,
Hmm.
they would think again, because
Yeah.
it is not death with dignity.
Wow. That would be, everyone should come to the conference and hear Dr. Hoff talk about the reality of MAID because that is an interesting conversation. And with how many people are opting for it. And again, like we were saying, you can see why people would opt for it in a country with healthcare collapse. My own Grammy, she had to have a surgery on her spine for bulging discs. She was in so much terrible pain. And if she'd had that surgery, she wouldn't have had to have an entire year of not even being able to leave the house very much and being in constant horrible pain. But the wait list was so long. And praise the Lord that my Grammy has a support system. She has a husband. She had people in her life who were able to take care of her and love her and support her through a very, very difficult time. But not everyone has that. There are so many people. We have an old neighbor who my grandma is his emergency contact because he has no family and he's in his 80s. And the healthcare system is just shoving him off. And if you think about how many people would choose MAID simply because they don't have a support system and they're not receiving the medical care that they need, you can see what leads them to make that choice. And it's heartbreaking.